Hello everyone, I am Dr. Megha Saroha, Senior Consultant in the Department of Pediatric Hematology, Oncology and Bone Marrow Transplant at Dharamshila Narayana Hospital, New Delhi. So today I'll be discussing with you what is leukemia in children, what are the symptoms and what are the treatment modalities which are available today. So what is leukemia? Leukemia is basically the medical term for blood cancer. When does it happen? So when the cancer cells start growing abnormally in the bone marrow, blood cancer occurs. And the abnormal growth of the cancer cells in bone marrow leads to depletion of the normal blood cells which are produced in the bone marrow, that is the RBCs, WBCs and the platelets. So because these normal cells are not been able to produce in the body, there are various signs and symptoms which happen in children. Firstly, there is prolonged fever or there can be repeated infections in the children. Second is looking pale or being extremely tired. Third is easy bruisability or bleeding from any place in the body. Fourth, there can be joint pains or other bony pains. Fifth is poor appetite or extremely low appetite in children. So all these symptoms are an indicator that the child may be suffering from blood cancer, though these symptoms can happen in other conditions as well, but being prolonged and repeated occurrence of these symptoms can be an indicator for blood cancer in children. And so is leukemia or blood cancer in children treatable? So yes, it is treatable. Currently, there are various modalities which are available which can help in treating leukemia in children. First and foremost is chemotherapy. So chemotherapy is the backbone of blood cancer in children and is the main upfront modality which is used. This leads to very high cure rates, and but there are certain side effects also which come along with chemotherapy. Second is immunotherapy or and CAR T cell therapy also. Immunotherapy is not generally used in upfront treatment of blood cancers, but when the disease is persistent or refractory or in relapse setting, their immunotherapy and CAR T cells have a very important role. So unlike chemotherapy targets all the cells in the body, including the abnormal cancer cells. Immunotherapy generally targets just the cancer cells. And on the other hand, CAR T cell therapy is when the T cells of the patient are taken out of the body, they are engineered and they are made such so that they can attack the cancer cells, and they are then again infused back to the patient. So they target the cancer cells only. So CAR T and immunotherapy are generally used as a second line and not as a front line. Third important modality is bone marrow transplant. So bone marrow transplant is only done for high risk cases and not for all cases of blood cancers. So when the disease is persistent, that is, it is refractory, it does not go away with chemotherapy, or when the disease relapses or comes back after initial treatment, then bone marrow transplant is also one of the modality which is used. So, in short, the treatment for leukemia or blood cancers in children is available. Blood cancers are highly curable, and unlike what we think that children have low power to tolerate treatment, on the contrary, children are more resilient and they are able to tolerate treatment much better than the adults. So on this note, I will just request you that if there is any symptom, you should see your pediatrician early so that the symptoms can be tackled in a better way.